Hello, everybody, and welcome to this session on making early warnings count, labeling action and inclusivity. Thank you very much for coming. We're coming to the end of 3 days, so we'll try and keep it as interesting and engaging as possible. My name is Susanna, and I work as a research manager at the GSMA.
And I'm Jessica. I work as the Senior Partnerships and Innovation Lead at the Red Cross Global Disaster Preparedness Center.
Great, so just for a quick background, for those of you who don't know who the GSMA is or might not be so familiar, it's the Global Trade Association for Mobile Network Operators. And I specifically work in the foundation, which is called the Mobile for Humanitarian Innovation Program, which we're gratefully supported by the FCDO. And what we do is we work with the mobile industry to build resilience and respond effectively in humanitarian crises. And we do that in several ways. So the first is we convene the industry by coordinating with authorities and humanitarian agencies to catalyze partnerships. Secondly, we fund innovative projects. So we have an innovation fund, which we provide grants to humanitarian organizations leveraging technology. And thirdly, through our research, which is obviously where I come from, where we research emerging innovation and highlight best practice to the wider digital humanitarian ecosystem. And as an arm to that research, we also have a policy team. So I'll stop there and let Jessica say what it is.
So again, we're part of the Red Cross Red Crescent Network. The Global Disaster Preparedness Center is a reference center that was established by the International Federation of Red Cross and Red Crescent Societies, but we're hosted by the American Red Cross. We've been around for almost 11 years, and we work in a couple of different areas. We work in the area of technical advising when it comes to disaster preparedness, primarily to support Red Cross and Red Crescent national societies around the world to build their capacity in preparedness. We also work in knowledge management, so we are really engaged with conducting research, identifying gaps, building good practice, sharing good practice, and trying to make sure that the network of practitioners that are working in the disaster preparedness field have access to the information they need when they need it. And then finally, we work in the area of developing tools and innovation. So that's where I come in. I work on our innovative activities. A lot of it in the past has been around digital technology products such as mobile apps, websites, etc. But we're really focusing more and more on research and innovation in a local community context, and that's what we're going to be talking about today.
So for our session today, what we are going to do is Jessica and I are going to share some research that we are currently working on, sort of in tandem. We're both working on 2 research projects in very close alignment with each other. And then we're going to break out into a couple of groups, and we've got some questions for you before feeding back into the room. But we'd also just like to caveat that we'd like this whole session to be really discussion based, and really using this research as a catalyst for things for us to talk about. So we might pose questions to you during our presentations. If you have questions, please come in. We want this to be a kind of as dynamic and conversational as possible. Oh yeah, we're going to start with a quick warm-up activity to get everyone moving after lunch.
So we're going to start with just 2 questions. If you can go to menti.com and enter this code, or you could scan the QR code if you're here in the room, or you can probably scan it from Zoom as well. We're going to ask 2 questions. The first one, I know that we've had a lot of conversations over the past few days about inclusion and inclusivity, and so we want to capitalize on the fact that we've been talking about that a lot, and give us a word or a couple of words that reflect what inclusivity means to you, like either based on your own personal experience or based on things that you've learned throughout this week. Yeah, these are great. I think it's important for us to to understand the definition of inclusivity that we're working with as we're going into a piece of research that really focuses on this. And you're capturing a lot of the pieces that we're really thinking about when we're conceptualizing inclusion and inclusivity when it comes to our research. So let's go to the next question. We've been talking a lot about the challenges in early warning and early action this week. So what gaps, in terms of like what you're thinking about for inclusivity, what gaps exist? What do we know are problems and challenges in the space of inclusivity when it comes to early warning and early action?
Not listening to local knowledge.
Tends to cater for general group, less so for minority groups. Good stuff on local knowledge, access to technology, rarely helping the underserved, differentiated needs and capacities. That's really good. I like that. Digital divide? Yes. Yes, absolutely. I think that's a really good point.
It's quite interesting that we can all sort of think of loads of words to describe inclusivity, but then we struggle more so on what we're actually, what we're not achieving.
We've got some more here. Official data does not represent the most vulnerable. Viewing people as belonging to one category rather than multifaceted. The practical implementation, yes, thank you. Identifying the method most needed for each different person. These are really great. Not thinking about elderly groups. Yeah, absolutely. And thinking beyond the majority to the most vulnerable. These are really excellent. These are really excellent answers. Thank you very much for this. You want to switch back over to the deck?
Yeah.
Participatory. What does this last one say? Participatory approach. Ooh, they're still coming in. Amplifying existing power dynamics. Yeah, and I think especially when we're talking about things like the digital divide, there's potential that any implementation that we're doing is exacerbating the problem rather than making things easier. A tick box exercise, yeah, just paying lip service to inclusion rather than actual inclusion. There's language barriers. I was looking for that one. All right, co-production is now just a word for having many meetings. Ooh.
We done?
Yeah. Okay, great. So just a little bit of background on sort of why we're here and why we're talking about this, and why we're talking about this together even. Of course, we're very heavily influenced by the Early Warning for All initiative, with the idea that every person on Earth is protected by an early warning system in the next 5 years. It's a really ambitious goal, but one that we are using as inspiration for a lot of the work that we're doing. WHO plan incorporating the 4 pillars of early warning systems. We are focused on the third, being warning dissemination and communication. So that's really where we're focusing the work that we're talking about today. Understanding that 1/3 of the global population is still not covered by early warning systems, and even in places where there are early warning systems, it might only be for one type of hazard. So just because there's coverage for, you know, from a hydromet office doesn't mean there's coverage for geological emergencies or epidemics or things like that. So even if there's coverage in some places, that doesn't mean it's comprehensive coverage and multi-hazard coverage. And despite warnings being issued, as we know, and as we've been talking about this week, marginalized groups are often at greater risk of exclusion, especially as services are increasingly digitalized. So coming back to this idea of the digital divide and sort of exacerbating some of those inequalities, even when we're trying to help. Okay.
Yeah. So what we're going to do now is Jessica and I are going to run through and have a little bit of a conversation about 2 of our research projects that we're currently working on. They are separate projects, just to be clear, with ever so slightly different objectives, but we'll get to in a minute. But we designed them in parallel on purpose. So we've put our heads together and our methods are very much aligned, and our process is all very much aligned in order to package up and corroborate our findings so that we can cross our findings over so that they can apply wider where applicable, but also so that we can package these projects up for a wider audience together. And I think, yeah, so Jessica, could you please tell us what are the research objectives of your current project?
Yes, absolutely. So what we're looking at is primarily we're looking at identifying the existing challenges in the existing gaps in early warning, early action within last mile communities in a couple of countries in Latin America. So we're specifically focused in El Salvador, Honduras, Guatemala, and Colombia. And we really want to understand for each of these, so we're working through our national societies who are helping us to identify the communities that we're focusing on. And for each of these communities, we want to understand, are they receiving the messages at all? Are they even reaching those communities? If they're being received, are they being understood? If they're understood, are they being trusted? If they're being trusted, are they relevant? And if they're relevant, are they actionable? So we're really looking at sort of all of those different pieces, not just whether or not they're receiving the messages, but what are the next steps after that? What are they able to do with those messages? And then in addition to that, what we're really interested in, we're focused on a research and innovation project at GDPC. So we're looking at not only what challenges exist, what gaps exist, but how can we help to fill these gaps? We have the benefit of some grant funding that we can use to put forward an innovative solution. So we're looking at whether or not the local communities might already have some method of addressing these gaps. So, if we're talking about trust and the local government is not necessarily, or the national government is not necessarily trusted, is there a community leader who's getting that information and disseminating it to the population? Is there some sort of workaround that's already being implemented by the local community that we might be able to improve upon, replicate, amplify, or in some way help to support those existing solutions? Or if no good solutions really exist, co-developing with those communities a potentially innovative process or tool or some other kind of solution that we can use to help address these gaps that we've identified through the research. There we go.
Great. So as you can probably see from the slides, our objectives are in fact very similar in that we're aiming to identify the barriers to receiving, accessing, and acting on information so that we can then come up with solutions to address these barriers. The key distinction, though, with the GSMA research is that we're looking at user experiences and barriers specific to the role of mobile, and how we can improve inclusion where mobile and the role of mobile is concerned. So whether that be digital access, digital literacy, when it comes to receiving them, what's the access to mobile, but maybe, it might be other barriers too, which we'll get a bit to later as well. I should also add that we're also looking at where mobile may not be the best solution as well. And we're looking at different points of the value chain of where mobile is being used and at what point barriers are presenting along the whole early warning sort of risk communication value chain. So that could stop at a Red Cross volunteer dissemination point, So yeah, ours is specifically around the barriers presenting where mobile is used.
So in terms of who we're trying to reach with the research, they have a couple of target audiences. We have government and humanitarian organizations, the affected communities, and then humanitarian organizations who are working on this kind of programming. So we want to make sure that when we're talking about the design and dissemination of early warnings, that we're really including all of our stakeholders. We're thinking about the alerting authorities, the hydromet offices, the geological offices, the national disaster management agencies, all of those different alerting authorities, and other government organizations who are responsible for either risk communication or disaster preparedness and response. Also, the humanitarian organizations who are also working in this space, we want to make sure that we're being complementary to other work that's going on instead of duplicative. We want to make sure that we're engaging with other actors in this space. But then primarily, looking at the affected communities, we're really doing the research and doing some of this work to make a difference for the affected communities. So we are really heavily community focused in all of the research activities.
Yeah, and just to add for the target audiences for the GSMA, that also includes technology providers and mobile phone operators who might be working on risk communication programming or engaged in this space as well. So if we move on to project design, the GSMA's project and the Global Disaster Preparedness Centre project are again quite similar. How we're doing it is we are undertaking desk research and key informant interviews, of which has already happened. We have an inception report and field work plans, which has also already happened. A development of tools, which has already happened. So we have a huge catalogue of all of the tools and methods that we're going to be using in country. And then we are going to have our qualitative data collection. So what this is going to look like, it's going to be a series of design sprints in multiple locations where we're going to work with communities, doing workshops, co-creation sessions, in-depth interviews, all kinds of fun, creative things. And then that will be analysed and put together in a report with a little bit of cross-collaboration to be disseminated and fed back to the Red Cross, who is our partner.
And ours is very similar, where I think maybe 2 months or so in terms of timeline behind where GSMA is, because we're not perfectly in alignment with our timelines. But we've already completed the desk research. We've already done some of the key informant interviews ourselves, but then the next step that we're looking to start within the next couple of weeks is the data collection with the communities, which will then feed into the analysis and an initial report, which will talk about the gaps and the challenges. And then we will move into the co-creation of the solution with the communities as sort of a follow-on step that'll be sort of after the primary research is conducted. And then developing and piloting whatever the innovative solution is, and then having a final, and then having the dissemination after that.
Okay, so to the more interesting place itself, South Africa. We are doing this project in partnership with the South African Red Cross, and we're going to be doing it in 3 main locations. And I'm going to speak a little bit about why we chose these locations, but also we're choosing specific personas in each of these locations to look at what barriers are presenting for them in terms of the risk communications happening. And I'm also going to explain a little bit why we chose those personas in each location. But I'm just going to stress before I do that although we have chosen one sort of group in each place, or maybe 2, so women and young adults or migrants, we're still taking a very intersectional approach. So within these workshops, we're still going to be looking at all of the multitudes of ways that these people might be experiencing barriers to receiving communications. So if we start with Durban, should we start with Durban? Yeah, that should say Durban, but yes, it does, Durban Metro. We'll start with Durban Metro, which is the most populated city in South Africa, located on the east. And it's experiencing a population boom from the surrounding city areas. And because of that, a lot of these people are packed into informal settlement, and there's a massive housing demand causing quite poor living conditions. They also experience intense storm surges, floods and landslides. And recently, in one of the hardest hit floods, 459 people lost their lives. So we have chosen to look at what barriers might women be presented with in being communicated to, and their sort of understanding and reasons for actioning that. So why we chose women is because they're not the breadwinners of the household, which means they're financially dependent on their male partner, and it's their partner who often is the primary decision maker. And this is also during disasters. And during disasters, gender-based violence often increases as well. And they also might have, because of these sort of household structures, and particularly having come from a more urban environment, they often have less access to mobile phones in this area as well. We've also chosen young adults in Durban Metro, because of the influx of people from urban areas, they are more likely to use chat platforms such as WhatsApp, or spending their time on social media. So there are some avenues that we can explore with them on a sort of slightly different scale of digital literacy than maybe some of the other areas. In Messina, which is peri-urban, that's sort of on the border between Zimbabwe. Historical inequalities have left the population with much fewer resources and lower financial means. And combined with poor service delivery from local governments, this has left communities in a cycle where they're unable to react and recover from climate-related shocks. And mobile infrastructure provides quite an opportunity here to reach many segments of the population, with a mobile penetration rate of 187.4% and an internet penetration of 91.3%, which is pretty high. So unfortunately, they also do suffer from quite a lot of power cuts, network coverage, and high data costs. So we'll be looking at that too. We have chosen, we've chosen migrants here, mainly because of the because of the location being so close to the border. There's quite a high amount of migrants in this area, and migrants tend to have quite unique challenges when it comes to the barriers that they face in digital technology. They may have different access to SIM cards requirements. They may have different kind of geographical coverage reasons, because their phone might have come from different places. So there's lots of different barriers that migrants face, and there's a high amount in this area, which is why we've chosen migrants. And then the third location that we're going to be looking at is East London, and this is a very rural area, and one of the poorest in South Africa. Most communities here rely on subsistence agriculture and social grants from the government. And here we've chosen the elderly, which is those 65 years and over. And the reason that we're going to be working with the elderly here is because they have fewer options to respond to climate risks, and they rely on others very heavily and have very limited mobility. They're not very tech savvy, and they're likely to use basic or feature phones. And they mainly use phones for making calls, as they have difficulty reading small text. So that might present as quite a significant barrier if you're sending risk communications to an area where there's a high amount of elderly people who don't use texts, and that's how you're trying to contact them. The other persona that we've chosen here is people with disabilities. And the reason that we've chosen people with disabilities is because these populations here often don't receive communications through channels like mobile phones. They're often reliant on others, and they may need, given the sort of geographical context and how it's so rural, relocating it may be quite difficult in terms of mobility, which is why we've chosen people with disabilities in this area as well. I'm going to stop rambling now. But that should hopefully give you a sort of overview of the kind of people and context that we're going to be working in.
So as I mentioned a minute ago, the project that we're working on with GDPC is a little bit behind in terms of timing as compared to where GSMA is. So we're still in the process right now of determining exactly the locations that we're going to be working in within each country. We're working through and with our national society partners in those countries, because they know their country, they know their communities much better than we do. So they're currently in the process of identifying 2 to 3 locations within each country for us to conduct the research. And we've provided to them some guidance around the types of marginalized and last mile communities that we're interested in working with, and that overlaps a lot with what Susanna was saying. So we're looking at one of the big ones that we're looking at is migrant populations. It's a very big challenge in sort of the Northern Triangle, like Central America location, and then again in Colombia with the internally displaced. So we're looking at that as an area as a community of focus. We're also looking at the elderly and people with disabilities as a priority. We're looking at indigenous populations as a priority, and then women, and then the other one, the LGBTQ community, if there's any sort of different way that those communities might be affected or impacted by early warnings. Oh, and the reason why I showed the map is just because one of the ways that we chose these countries is based on their risk profiles. So there's a high amount of risk in terms of flooding, landslides, tropical storms, those sorts of, and then volcanic activity in some of those areas. So that's why we chose these countries to begin with.
So we, within this research, are going to be using what's called the marketing reach model to help us better understand the different steps that need to be implemented for effective risk communication. And this model was introduced by the WMO and is quite a well-received framework, as we've discovered by talking to lots of KIIs and global experts. And these will be no surprise to all of us here who have attended sessions over the last few days where these themes have come up time and time again. So the desired behaviors that we're going to be looking at with the people in each context are: we want people to become more aware of the risks before they experience harm. We want people to trust the sources of information about that risk. We want people to understand what the content of the risk communication means. And we want then people to be able to take preventative action to reduce harms from those risks. All very nice, but how do we make that happen? So we know these things. We've all spoken about them: awareness, trust, understanding, action. So how do we make that happen? We need to explore what the current barriers are in any given context that are preventing these from happening, so that then we can come up with solutions to overcome them. So to get a bit more of a sense of what that looks like in real terms, this slide has some of the potential barriers that might fall under this framework. So I won't read them all out, but these are some that we've come up with, and I should say these are potential barriers. These are what we've come up with, having spoken a lot with the South African Red Cross about their current experiences of the programming that they've been doing. We've been talking to local experts. It's come from the KIIs that we've done the interviews and some of the research, but this isn't findings from the actual qualitative fieldwork that we've done yet. But this is some examples of what might come up. So, for example, in exploring barriers to trusting early warning messages, misinformation might come up, or people might be receiving too many messages, and therefore, the overload makes them distrust it. In regard to understanding, we believe, especially in South Africa, that language is going to come up as quite a big barrier because there are 11 official languages. Action. Some people might have limited mobility, they might have no transport, they might not have no safe space to go to. Previous disasters might mean that they fear leaving what they've now settled with. In terms of mobile barriers, there are some specific mobile barriers that we can look at too. So in terms of awareness, what's preventing people from receiving those in certain areas or due to their kind of identity? Could it be that they don't have a working SIM card? Why? Could it be that the data is too expensive for them to receive SMS messages? Do we need another form of communication then? Could it be digital literacy? Could it be access to charging? So all of these things are kind of, just examples of barriers, the many barriers that might come up against these four criteria that we're looking at.
So these should look very familiar to you based on the conversations that we've been having this week. But also, again, like looking at the desk research that we've been doing, looking at some of the findings that have been coming out of sort of the initial pieces. These are things that we know. These are things that we know are important. The importance of creating clear, unified, and targeted messaging, leveraging standard early warning system messaging components. We are looking at intersectionality, building on what already exists. I think that's something that that is really important. You know, whether that's something like an existing social structure or an existing infrastructure, I think making sure that we're building on things that already exist are better than making something from scratch. Looking at recognizing the most vulnerable, empowering the user, understanding that digital solutions are not a silver bullet, no matter how much we would like them to be, and focusing on the actionability of the messages. Next one too.
So as I mentioned at the beginning, we've aligned our projects to have very similar methodologies. And so I'll just quickly explain what we're going to be doing on this slide. So we're going to use a mix of participatory and human-centered design methods to engage with participants in all of the sessions. And during each design sprint, we're going to be conducting the qualitative research using in-depth interviews and focus group discussions. Each session will begin with a short survey-style Q&A to harvest basic information like mobile usage, technology capabilities, previous risk communication, engagement experiences. And then based from that, we're going to facilitate co-creation sessions where we'll explore ideas with the participants to come up with creative solutions, or looking at what knowledge they already have that exists that can be harnessed to overcome some of the barriers that we've identified. So just a little example of some of the things that we might do in some of the interviews. We might reflect on past disasters, looking at what happened before, asking things like how they found out about it, were there any warning signs, was there any information you and your community didn't trust or understand during the disaster, what action was taken, reflecting back on challenges, what helped you the most, who helped you the most, where there isn't maybe an example that they can think of. We're going to be providing hypothetical scenarios as well. And in the group workshops, we're going to be jointly creating personas. So we're going to have all of the participants in the room create fictional individuals based on the experiences and the livelihoods and lives of everybody in the room. And then using those fictional characters, we'll be running them through scenarios, we'll be playing games with them to see what they would and wouldn't do in certain situations. And in the co-creation workshops, we also have a number of activities that include weather word games. We're going to be doing role plays, pitch decks. So basically creativity as another theme of this conference is something that we're really trying to include in all of the sessions that we do.
All right, so a couple of things as we get to sort of the outputs portion of what we're doing and what we're interested in doing with the information. One of the things that's really important for us is to feed back everything that we're finding to the Red Cross national societies that we're working with and validate the information with them to make sure that what we're uncovering resonates with them and that they can validate a lot of what we're talking about, but also so that they're able to take some of our recommendations, whether, for us, we're looking at sort of doing some implementation of an innovative solution afterwards, but making recommendations to the national societies that are actual actionable things that they might be able to take forward. We're also looking at generating a final research report for all of the cross-cutting findings. We're looking at ways that we can do comparative outputs once we're sort of both to the point where we have our findings and we have our research results. We're looking at ways that we can compare those two things and be able to share the similarities and differences across our two projects, because I think that'll be an incredibly interesting way to have a more in-depth understanding of what we're both doing, to see sort of what the similarities and differences are between our different contexts. And then, yeah.
Can I just add something?
Yeah, go for it.
Yeah, obviously our primary people that we're disseminating is to our partners, which is the Red Cross National Societies, whose risk communication program we're going to be looking at within the workshops. But we're also going to be disseminating our findings in slightly different ways back to the communities and the participants of the research that we've been working with as well, and bringing them along the kind of what's going to be happening afterwards and how they can remain involved.
Excellent.
Does anybody have any questions before we go into some group discussions? Yes, I can see one up there.
Bob Goldhammer, International Association of Emergency Managers. Question I have is this. In one of the slides you had up there, your target audiences, you mentioned key audiences for the research are stakeholders involved in designing and disseminating any risk communication systems. So the question I have, and this may be out of your scope, but one of the problems we've run into in the United States with the use of early warning systems through the mobile technology is that different mobile company service providers use different procedures as far as which phones they activate. Sometimes the phones are going off because they're within a certain distance of a cell phone tower, which is the desired thing. But sometimes the cell phone towers are activated because they're within a certain distance of the warning. Other times they may just be in somewhat proximity to the warning, but not actually impacted by it. It's causing and has caused a lot of confusion. I'm just wondering, is this something that's being considered at all as you try to develop these systems in these additional countries, as far as getting the service providers themselves involved in the delivery and, more importantly, development of the process to maybe avoid some of the problems that we've already encountered?
Yeah, thank you very much for your question, and it's a really good one. I think the mechanism that you're referring to most in that question is cell broadcast, which is when it's what we experienced recently in the UK in a practice run when you get a geolocated blast to your phone that beeps. It's not an SMS, it doesn't know your number, it does by geographic through if you're within the certain range of that mast, you will get the beep. That technology is not used everywhere. Mainly it's used in Europe or the Northern Hemisphere. We haven't had such a high use of it because of the digital divide largely. But I would think the answer to your question as well, I think, is very context specific. So in places like where we'll be doing the research, often mobile isn't the channel for the sort of final dissemination of a communication. It often stops at a community volunteer or a Red Cross volunteer or even the National Society. And then the chain from there might be community groups, meetings, megaphones. You know, where phones are used, we're seeing kind of WhatsApp groups or channels being really useful because people trust them. They're groups that they're already in. So yes, short answer, yes, people are looking at those issues, but very much on a context by context basis, of which this is not one of them, so I don't have all of the answers for South Africa. But a really, really interesting question for sure.
Hi, Mariana Budimir from Practical Action. Really great work. Two questions. First one quickly, when can we expect to see the results and the tools? And secondly, in terms of the focus group discussions and your engagements with those specific groups, there's obviously some diverse needs in those groups, what kind of approaches, techniques, adaptations are you thinking about and considering when tailoring those engagements, the co-creation workshops, the focus group discussions to those specific groups?
Okay, so the answer to your first question is sort of slightly up in the air as of today, but we are looking at sort of early next year. And in answer to your second question, how are we kind of tailoring these the sessions that we're going to be doing with communities based on their specific needs? So we're working extremely closely, like I mentioned, with the South African Red Cross, and they are responsible for recruiting all of the participants and also enabling the right access and like environment for those participants, because they work so closely with them already. So for example, where we're working with people with disabilities, there'll be help to, if they need it, to come to the site. There'll be accessibility requirements put in place. All of our participants are also receiving a kind of, I don't know what you call it, stipend or like a, what's called incentive, as well to participate. I can't answer for every single group what exactly the tailored needs, but the South African Red Cross is very much, and the partner that we're working with, 17 Sugars, who are also South African based, is very much part of our agenda written in the plan, that those needs are looked at and made sure that they are incorporated into all of our workshops.
In terms of, can you hear that? Okay, in terms of the timeline for ours, it's going to be a couple months later, as I keep saying. But so we're looking at the research report to be available around the end of March, and the implementation of the tools in sort of the April, May, June timeframe. And the only thing that I wanted to add in terms of the methodology, in terms of like your second question, is part of ours is going to be based on the vulnerability and capacity assessment that the Red Cross and Red Crescent National Societies already do. It's a very well developed and well-known tool that is incredibly engaging in terms of, you know, helping communities to you know, do their own mapping, and sort of, you know, they'll take walks through the community, they'll do activities on paper. And so it's really integrating the specific community, like with this methodology that's already it's already been used and in place in those countries.
Mark Harvey, Resurgence. Yeah, great work. I found myself thinking that there's a very understandable focus on dissemination and uptake from vulnerable users, but I wonder whether it's within scope to consider the utility of mobile phones to actually, and applications within them like WhatsApp, to convene the system, the actors in the system, and to actually help them communicate, and also to allow feedback within those groups of actors, because that's how we have been using, certainly in urban contexts, WhatsApp, and it actually, that has arguably been the primary value of the smartphone, whereas it's been feature phones that we've been using for dissemination. But exploring those dynamics around how this can support the system to coordinate, to respond, to adjust, to feedback to itself, is, I think, it may be a separate research project, but it somehow seems connected with this. Yes.
Yeah, thank you. A really good point. I think it is a slightly separate point, but I do think that to multi-way communication is something that is going to come out very much at the end of all of this as a proposed solution to a lot of the barriers that we might face, like WhatsApp. We've been talking about that for a while, and to your first point, we will be looking at where mobile and these channels are used, not just at that, final communication stage, but throughout the whole value chain, and where the blockages are. So we actually have like this map that we've drawn with the South African Red Cross of the whole system from when it comes from the weather service, and at what point mobile is an actor within that map, so that we can see at what points it can be harnessed, shouldn't be harnessed, and what the blockages are as well. So yeah, not quite in the scope, but I think it will play a big role coming in at the end. I don't want to sort of deny the importance of it, because I think the sort of two multi-way communication engagement piece is huge, and I think that's going to be what will come out of this research massively as well. Yeah, I was going to say, do we have any questions online?
So this online question is from Dr. Bob Alexander, and he has written, I'm happy to see electricity charging listed as a barrier. I feel like this was missed in some previous sessions. Many marginalized people in South Africa have cheap and secondhand phones with battery lives of only an hour or two. The question isn't cell phone penetration or even just power outages, though that's huge. It's about how many and which hours people tend to have their phones on or off or away from their houses charging somewhere else. A cell phone shouldn't be aiming to replace traditional communication systems in such contexts. How might cell phones complement such traditional systems?
Yeah, thank you so much for that question, and it's a really, really excellent one. Yes, we think that electricity and charging will become a barrier, and we'll be doing journey mapping and user diaries to look at people's phone usage and the barriers like that one, like you've expressed, and in those cases, this research or the GSMA at no point would ever advocate for mobile as a silver bullet to work on its own. And that's really a really critical piece of this research, is to highlight that actually often that's combined approaches that are the best, or sometimes completely traditional methods, and if that's the finding, then that's the solution. So yeah, Jessica, do you have anything else to add?
Yeah, that's great.
But yeah, the solution will come from working with the communities as well. So I may not have the answer to the barrier because I haven't got to the end of the project yet. But we'll be working with those communities to come up with those solutions.
Okay, Bob Goldhammer again. I know obviously you already have your locations picked out for doing the research, but as part of your study, are you maintaining any kind of a log of events that happen around the world, the number of victims of those events, and any problems that were identified in the use of any early warning system? I'm particularly thinking of what just happened in Greece and Libya. I haven't heard anything coming out about how things went, what problems have been identified as far as communication of the risk at the time of the event. And I'm hoping somebody's keeping track of that kind of stuff, but I don't know if you have any information on that as far as those particular events, or just whether or not you keep a log of those types of events.
I wouldn't say that we keep a log per se. What we've done is in the desk research portion of the work that we're doing. We've looked at previous alert dissemination and looked at sort of where some of the gaps are there. I don't have it in front of me, and I don't want to try to misrepresent what's actually in the findings and the literature review and the desk research, but there are components of looking at that within the geographic contexts that we're talking about. So, the last time that there were landslides, or the last time there was, a major hurricane, what were the warnings that were sent out? What percentage of the population received them? Those sorts of things are in there.
Do we have any more questions? I think we have one just there, yeah.
Hi, I'm Paulina. I'm a master's student at the IRDR. It seems like you've got a really robust methodology, which I like to see. What I wanted to ask is, will there at any point be a chance for the participants to take part in kind of a feedback process once all the kind of focus groups are done and the co-production workshops to, you know, say what worked for them, and, you know, if you do projects in the future to try and incorporate that to make it a truly kind of people-centered approach? Thank you.
Short answer, yes. Yes, once we have done the sort of qualitative data collection with the focus group discussions and the interviews, we'll then move into the co-creation workshops. After those, we'll be doing the analysis, the reports, and etc. But we'll also be not just packaging those findings in different ways to deliver back to the communities, but there will be options for feedback, very much so as well. Yeah, through the channel of the South African Red Cross. So yes.
Do you mean specifically like feedback on the research process itself and sort of their experience going through that? I don't have that written into my piece yet, so I really appreciate you raising that, because that's something that we can raise with the researchers and see if we can incorporate that. I appreciate that. Thanks. Are there any other online questions? Okay. All right.
Great. So in that case,
Oh, that hasn't moved. Should we do the?
Yeah, let's get to this.
so what we thought we'd do now was, you've probably had enough of listening to us talk for a bit. So if we could kind of group ourselves, maybe 2 groups in the room and then online. How many people do we have online? 9. So maybe that could be one group in the chat. And if we want to just, in our groups, do you want to deliver them separately or do you want to just do them all?
Let's do them one by one, because I think.
Yeah. Okay, so if we get into groups and start with maybe the first 2 questions, and just come up with maybe a few lines, and then we'll be feeding that back to the group and facilitating a bit of discussion around them. So yeah, if you want to like shuffle maybe this half of the room, we could like, you could form a group, and this half, 1, 2, 3, 4, 5, or maybe 3 groups, up to you.
2 in here, right? Sounds good. You can do 2 in here. Sounds good.
And then for those attending online, feel free to discuss in the chat. The questions are: what do you perceive to be global best practices for identifying adequate delivery mechanisms and designing and contextualizing messages? And then the second part to that question is: how can we link best practices to respond to measures and action? And let's go with about 10 minutes, 10-15 minutes in your groups to discuss. Yeah, we'll come back at around 2:45 to feed back into the room, and also feedback from the online group as well. Okay, so we have kind of hit time, so if you could wrap up your discussions, and we'll feed back. Which group would like to start with some of sort of top liners of what you've been talking about in your group? Wow, no volunteer. Yeah, go on, Mariana. Let's hear what you've been talking about.
Thanks. So I don't know whether this is going to make any sense. There's just lots of notes, lots of discussions. In terms of global best practice, I think some of the things we were talking about is that there are some things out there, but there's not anything that's consistently done everywhere. And you see this in terms of that's where you see the gaps in early warning systems, in the fact that we're not identifying how to design them to be the dissemination communication to be appropriate for everyone. So there are common alerting protocols which help in terms of the format and some of the content, but in terms of going to the first mile to understand their needs and the differentiated needs, that's not really coming through consistently in very many places across the world. And then also thinking about different user groups beyond the majority is a big gap. There are some techniques in terms of understanding kind of different user groups, but actually building that into the system is difficult. So we haven't come up with solutions, we come up with lots of problems. There are some examples where, for example, working through community agents as brokers to those communities to understand what are the delivery mechanisms and the messages that are needed for them. We're also talking about the examples from volcano early warning systems, where there's some really great examples where this has been done very well because they've had a smaller group of people that are affected by the volcano. So you've got you can have a much closer relationship and understanding of those needs, but replicating that elsewhere or replicating that across kind of diverse geographies is quite difficult. We did talk about there are some examples where there are methods to understand user groups and vulnerabilities, and there's recognizing that there's additional efforts that need to be done to reach the most marginalized, and that has to be done with sensitivity. And there are some examples across the world where that's been done. Often it's reliant on intermediaries who have trust with those particularly marginalized groups and specific skill sets that may not be best normal practice in kind of research assistance. So it's making sure you're making those extra efforts to go beyond vulnerable people to the most marginalized. And then we talked also about the action side of things in terms of linking the best practice to the action. You really need to be working with those who are responsible for the delivery of the early warning messages or the early warning early action side of things, to make sure that you're taking them on a journey throughout that process to understand those needs, hear from it, and help them to design those response measures and those actions that are appropriate to those needs, rather than wait to the end of the project and give them a report that gives them a lot of problems to try and solve at a later date. Did I capture that?
Some really interesting reflections, yeah. Particularly around kind of efforts to go beyond vulnerable to reach the most marginalized as well. Was there anything that you picked up on? Yeah. That's and how it's quite an easy example because it's a small group, but then what can we take from that to replicate in much wider context? A very interesting question. I don't know if I have the answer, but I think it's something that we should definitely look into. Does the other group want to share some of their reflections around identifying global best practices?
So we kind of had a mixture of ideas. You can jump in at any point if I forget something, but we talked about the importance of culture and history as well when designing risk communication messages, so that those messages actually work with the populations and communities you're trying to reach. We also talked about the importance of warning length, how many characters a warning can be, especially if you're disseminating it through kind of cell phone networks or I think the geo-pinning as well, or social media. Something that was interesting that came up was that we haven't heard a lot about the cognitive aspects or psychological aspects of what makes an effective message. And we were talking about how, was it in the US, that sociologists were included for a long time in the discussion on disaster management, and they could have provided a lot of key insight on how to make these kind of effective warnings. So that's something that should be incorporated more. And I think a final point was that we often have kind of all these best practices and projects, but then where it falls short is the kind of review process. You implement something, but then you don't come back to see if it's actually worked. We have a lot of those kinds of tools for review, and we should be using those more to actually see if what we're doing is working or not. Anyone else want to add anything? Thank you.
Yeah, I think one of your last points actually, and I think it's a problem that we see across the sector as a whole, actually, is this implementation without follow-up or review. We do so much, we all talk about monitoring and evaluation and learning, but how often do we go back 6 months later to something, or a year later, or 18 months later, or 2 years later? And when do you decide when to stop? So yeah, I really like that point. Something that we can all definitely take away.
And also, I mean, one of the hardest things about something like that is, you know, how long do you wait after the disaster to try to go in and like make this kind of measurement? Because you can't go in right after somebody experiences an earthquake and be like, how did that warning go for you? Because they're still dealing with the trauma of the event. So the timing of an evaluation post-disaster can be really tricky. So that's a piece that I know that we struggle with sometimes.
Do we have any comments online?
Yes, there are a few. I know we're a bit short for time, but I can quickly sort of feedback. So some of the key points were about work with NGOs, agencies doing preparedness or early warning system trainings, and to ask these questions as part of training rather than standalone activities. So I think that was sort of more trying to like integrate it in a way. And then in terms of designing and contextualizing messages, so Paul suggested messages from NDMA, Red Cross, NGOs working on EWS to prioritize messages for different hazard contexts, looking at message effectiveness and art contests and other means of getting community feedback to revise them. And then also looking at linking message and delivery communication to action, the action good practices that are appropriate for the context and the targeted people need to be included in the message, i.e. the story yesterday about avoiding unactionable messages. So awareness isn't enough without people knowing what they can do to address the negative impacts of their family. And then a final point was about identifying and listening to community leaders, building relationships based on shared expertise, and building relevant methods for testing based on this knowledge, identifying problems as you go, and build better understanding by solving problems cooperatively, gaining trust along the way.
Excellent. Thank you. Thank you.
Yeah, I just wanted to add something on global best practices. I think it strikes me a little bit that given the nature of the disasters that you're trying to respond to, it's quite hard to. There can be long lags, right? Like how do you like factor that in to develop a kind of process of continuous improvement? I think, you know, in the South African context, for instance, it's like how do you learn from other or comparable initiatives to help you kind of shorten that design process? So, you know, in South Africa, there's a group, I think they're called Reach Digital Health now. They recently rebranded to have a WhatsApp-based product called Mum Connect. That was a national program for maternal support. And because the technology was there and widely used by the government when the pandemic hit, they were able to use that platform and adapt it and launch it very quickly within 2 or 3 weeks to be an information service that was used by around 12 million different unique South African users. You know, and in that context, they've been doing a lot of work on a lot of work to investigate how trustworthy those messages were, a lot of work to do A/B testing of different types of messages to solicit different responses. So I guess in response to the question, it strikes me that there are opportunities to really learn from a variety of different behavior change communication initiatives in the context in which you're working. So that was just another observation. I imagine GSMA is very familiar with Reach Digital Health and everything they do in South Africa. Yeah.
I think also to your point about the sort of lag time in between, like there are definitely places that have almost the opposite problem where, you know, disasters are happening so frequently that there's not an opportunity to take the time to learn from one and implement a change for the next one, because it's a constant cycle of response. So I think there's sort of the spectrum of those, you know, two different types of challenges. And how do we learn from something if we're going directly into the next, you know, how do we implement what we've learned if we're going directly into the next disaster? Yeah. We have 2 minutes left. I think we have a question for you. Happy to take any additional comments and things after the session, but our question for you is, both of our projects are sort of both in progress. So what have we missed? Like from the session that we're like, from the information that we've given you, is there anything that you think that we're missing that's a sort of piece that we need to consider, or, you know, any additional feedback that you'd like to give us as we're, you know, sort of in the midst of this project, and we might have the opportunity to kind of make a little bit of a wiggle if there's something that you think we could do to improve. Yeah.
Otherwise, we'll leave it there. Thank you very much. Oh, no more.
I can maybe see something really quick.
Okay.
Just one really quick thing was about the methods that you're using, and I can see how you try to sort of stage them differently and make sure you have different stakeholders and actors there. But there is sort of work going around about kind of having like non-verbal type or sort of more interactive. And I know this conference I have found has been very strong in that sense of doing like things a bit different or like not to the norm, but sometimes it's interesting how much like just a bit of a difference or an inclusion of a different type of method or way to talk about things, or artwork, or having even like an artist there to help support can really change things. So I think it might be a really nice opportunity, especially looking at a topic that is so sort of technology based, like with the mobile phones, of also how to look at it in a bit of a different way in that sense. For us.
No, that's great.
Yeah, totally agree. And I think, yeah, we are trying to make our methods as creative as possible, but I think that's something that yeah, we'll definitely take on board. You make a really good point about how it's been done at this conference as well, and I think that's so true. So yeah, thank you so much for that. We'll have a look.
Great. I just have a quick question. I was just wondering, when you look at the barriers for people taking action, most of the barriers that you listed as examples tend to be like structural or societal. There's not that much necessarily focusing on behavior. So maybe it's not that relevant in those contexts, but I know, like, for example, having worked on heat waves in the UK, behavior change is a big gap in terms of people doing things, either because they're not concerned enough about the risk or other reasons. So I just wonder whether that's something to explore further.
Yeah, thank you. And I think it will definitely, I heard an example earlier in the last couple of days about people not taking action if they didn't know other people were doing the same thing too. So kind of social conformity. Yeah, so there was an instruction to, I don't know, board up your house, but they would only do it maybe if they saw that their neighbor was doing it too. So yeah, the potential barriers that were on the slide were very much just preliminary. So we'll be exploring much more in the workshops, but yeah, we'll definitely be sure to look at behavior ones as well.
I was just thinking about the comment that you made when we talked about it the other day, where it was like the curve of who started wearing masks during COVID, and sort of people started wearing masks when other people started wearing masks. It's the same kind of thing. Yeah. Yeah.
And actually following up from that, I looked back at the project design and the flow. It might be well included, but I was thinking, how are you integrating in the prototyping and obviously the adapting? And I appreciate that projects usually have a start and an end. There are issues with funding.
Yeah.
It links back to, you know, all the monitoring but are you, especially because you're looking at technology that changes, linked to behavior, of course, how are you integrating the prototyping phase into the co-creation before, you know, the final reports, which I saw in dissemination that you're planning? Thanks.
No, that's a great question. And there's a whole sort of cycle that we intend to go through sort of during the design and implementation and piloting and, you know, all of that phase, that we just don't know exactly what that looks like yet, because we're trying not to pre-prescribe sort of what we think the solution is going to be. But yes, I take your point. There's absolutely a much more complex process that's going to be injected into that sort of implementation and you know, piloting piece that will be more iterative. Yeah. Thanks so much.
Great, thank you so much, everyone. And yeah, have a great rest of your day. I think this marks the end of the
I
conference.
think there's a post closing.
Yeah, okay, well,
Coffee and then a
this
closing session.
marks the end of the sessions. So thank you very much, everybody, and see you outside for the
Thank you.
closing.